Menstruation is the shedding of bleeding. Blood comes through the vaginal canal, through the vagina, and this typically lasts about 3 to 7 days. For some people, it can even be less than 3 days, maybe two, maybe, but at least 7 days. Hello there and welcome back here. I'm so pleased that you guys have welcomed me, have loved me, and I'm so grateful. I'm so grateful. This is me, Musawo Moomo, and we are still learning. We are learning, and I am here to give you the information you need, the information you deserve for pregnancy, prenatal, after birth, and baby care, breastfeeding tips. I'm your girl. So please subscribe to my channel, hit that notification button, like, share, comment. Let me answer your questions. If you have any question, if you have anything to add, please don't hesitate to do so. So today we are going to talk about an important and natural process in the lives of many people, and that is menstruation and the menstrual cycle. When I talk about menstruation, it is, of course, a topic most of us, ladies, men, women relate with, and it is so important that we understand a few things, understand these topics. It helps to promote health, it helps to promote hygiene, and even respect for others, because so many people are going through so many things in their lives, and maybe infertility, maybe some disorders in their menstruation cycles, and it would be important to understand how these things work before you sound or seem insensitive towards someone. And this is why I'm here to teach, to make sure people understand and learn. So first of, what is menstruation? Menstruation, of course, mostly known as a period, is the monthly shedding of the lining of the uterus or a womb. Most people that know as a womb, nabana buli mwezi nga evamo omusaayi, evamo omusaayi. That's what we know as menstruation, and it occurs, it is a monthly thing. Kibeerawo buli mwezi kirina okubeerawo buli mwezi, every other month, for menstruation to happen, unless if pregnancy occurs. So every woman who has reached menarche, who has started their menarche is when the very first period starts. Like menarche, for some people, it starts during puberty, in the ages of 9, 10, 11, 12, 13. That's when they start their very, very, very first periods. And when menarche sets in, you're good to go. You're expected to have a monthly uterus, because the body is preparing you for childbirth, is preparing you for pregnancy. And if you're not ready, typically, this is why I'm here, you're not ready for pregnancy, to understand what you can do to avoid pregnancy. So menstruation is the shedding of bleeding. Blood comes through the vaginal canal, through the vagina, and this typically lasts about 3 to 7 days. For some people, it can even be less than 3 days, maybe two, maybe, but at least 7 days. If it's more than 7 days, or even like up to 10 days, we are worried about that. And menstruation is a sign that the body is functioning properly and is capable of production. Literally, your body is working overtime every other month, preparing you to give birth. So it's up to you to listen or don't listen. So if you are having your menses, if you're having you're bleeding every month, it is an indicator that your body is working okay. and you are capable of giving birth. We have seen children about 9 years, 10 years giving birth in the news, on TV, and it's because when they had their first menses, maybe they went ahead and had sexual intercourse, and then the body is ready to get pregnant. Even when their bodies are not ready for childbearing, you find that they are the body for it is done. It is ready to do this, only that us as people, or a child who is 18, we still consider them as a child. So it's very important to know that it is important to give birth at least ngoze miaka 18 there. Your bones, everything is ready to what to go on. So what is a menstrual cycle? A menstrual cycle is the repeating series of changes that a woman's body goes through to prepare for a possible pregnancy. So, like I said, your body is working overtime every other month to prepare you for pregnancy. It is ready for it. The body is ready. It feels it's ready. It's you physically who is not ready to do what? To get pregnant. So the very first time a lady sees her menses, the body is ready. And this defines a woman's fertility. So imagine if maybe you had your menses when you were 17, 18 years. Like I said, we have our menses maybe between 9 to 13 years. So if you have your periods, if you start your periods, what we call the periods, late, it defines your fertility. Like let's say you find, that's why when women come to us for antenatal, the first question when we are taking their histories and talking to them, we ask them, when did you first have your menses? Like, when do you remember you having your first ever menses? Because to say this is a person maybe who is 35 years, this is their first pregnancy, and maybe they started their period at maybe 17 years, we are worried about their fertility, because the later you start your periods, the low chances of fertility for you. So when we have that information, we know how to educate you, or maybe if you've been trying for pregnancy and it has been futile, then we make you understand that because of this and this, because you started your periods late at when you are still a young girl, it is because you're having these issues. And some people don't understand that. Or when you started your periods at 17 years, it is important for you not to wait when you're like 30, 35, almost 40 for you to start having children. It is very important for you to start early so that your fertility is still on and going. So menarche is very important. It is very important to know when you started your very first period as a girl, because it helps to define your fertility. And a menstrual cycle usually lasts, the average usually lasts about 28 days, but it can range between 21 to 35 days depending on an individual, and it should be coming in every month. So when you are not menstruating every month, maybe you take like 2 months, 3 months, then that is irregular. Now we are deviating from the normal. So it is important to understand your bodies. It is important to know how your menstrual cycle is, because as a woman, this defines you. This is, if you maybe you want to also give birth to children, if you want to start maybe family planning, your menstrual cycle can tell you which family planning method to use or which to avoid, because from the information you give to a healthcare provider about your menstrual cycle, about how often you go into your periods every month, it helps one to advise this person better. So it's important to know this information so that when you're taking on certain decisions, you're able to know which one is best for you. We shall get into a discussion of safe days to know when you can get pregnant and when you cannot get pregnant, so that even if you let's say you're in a long distance relationship, you have a partner who understands, and you can use safe days to use as a family planning method. It is important, because some people are just using like certain family planning methods even when they shouldn't. Like let's say if you are not active, sexually active, and maybe your partner is away, you're in a long distance relationship, or it is important to use, like natural family planning method. So when you understand your cycle, very well, it helps you to know how to tackle maybe family planning and to make certain decisions, like I said. So we have a few phases of the menstrual cycle, because when you know these, you know how to move. And one of them is the menstrual phase. This is when the period occurs and the uterus sheds its lining, which is expelled as blood. Like, you have had your menses, that's when we start our very first day of the cycle. If I'm your healthcare provider and I ask you when you last had your menses, let's say maybe on first or second, I know that is the very first day of the cycle. And during this time, the hormone levels, and I said, the menstrual cycle is a brain game. There are hormones. Hormones are the ones that control the chemical processes in our body. So the mastermind of menstruation are usually two glands: the hypothalamus, the anterior pituitary gland. It releases hormones, and those hormones help the ovary to stimulate the growth of the follicles. When we reach the follicular phase, I can explain this further. But the hormone levels in the menstrual phase, when you're shedding blood, they are very, 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 very low. In this, we have the progesterone and the estrogen. Estrogen is more like our sex hormone, the women hormone that helps build our hips, our breasts, our guts. Like, it is our go-to hormone. This cycle, omwezi mulamba, the whole month, it happens in at least 3 or 4 phases. And the first one is the menstrual phase. The menstrual phase, jolabirako periods, when your periods start. When the very first day you see your periods, it's when the uterus is shedding its lining. It's when the blood is being expelled out of the vagina. That is the menstrual phase. Menstrual cycle, I see it as like when you're preparing for a party, preparing for a party, waliwe your phase, jemtandiko kutegeka, you're preparing, you're holding meetings, you're soliciting for money, you're checking for the decorators, you're checking for all the service providers. Then there's this phase of the coming of the visitors. And then there's a phase of when you really see the visitor. When the woman goes and picks that man out of the very many and shows us that this is the what? This is the man. So imagine you went through all this preparation, the uterus, the osasude caterers, osasude decorators, and then the man doesn't come. So the menstrual phase is when the man doesn't come, when pregnancy doesn't happen. The menstrual phase is the uterus crying that fertilization didn't take place. Omusajja talabiseko mugore akaba. You get, like, nothing happened. Maybe even intercourse didn't happen. The uterus was ready. There's a way they make the uterus very, very, very soggy and very spongy to prepare for this incoming ovum, in case it is fertilized. So when this doesn't happen, there is sadness all over and we menstruate. And when this time, usually some people take 3 days, 5 days, 6 days, 3 days, 2, like that. So it depends but it shouldn't at least exceed more than 7-8 days, because then that is extreme. So the hormones are their lowest, everything is down, everything is not going well. If the batimbi had come, they are going back without a balance, they are sad. If the mugole is in the room crying, so that is the phase. But it takes, now when that happens, maybe the woman nekunganya and goes back in the game of dating and gets another man, and they have to prepare for the party again. So this is the follicular phase. After menstruation, the body is like, you know what, we need to try again. And this is the stage where the body starts to prepare for the new cycle. So like I said, it is a brain game. The pituitary gland releases a hormone called follicle-stimulating hormone. Follicle is like the ovaries are like follicles. They are like small things. If you have ever like cut a nkoko, the chicken which is female, where there are eggs, there are those that are usually very big, there are those that are usually very, very, very small, that are usually those you can't even touch. They are like just a tissue which is there. So these follicles are that small. So when now the body starts on day one after ovulation, after menstruation rather, it starts immediately. So like, okay, this didn't happen, we need to prepare again. So this lasts up to like if your cycle is maybe like 28 days, your ovulation is expected on the 14th day. Usually it's like half your cycle. Like if your cycle is 20 days, ovulation usually happens on like the 10th day. If your cycle is 21 days, it happens between 10th and 11th day there. If it's like 35 days, it happens like on the 17th day or 18th day. If it's 30 days, on the 15th day, stuff like that. So it's usually half. So the body has at least 13 days to prepare for ovulation, so that another man is coming in to bring a baby to be there. If they don't bring, then we cry again. So that is how our body works as women. So when this happens, the brain starts immediately. I told you it's two masterminds, the pituitary gland and the hypothalamus. It releases a hormone. This hormone is the one now to send signals to this ovary to start. Every month there is an ovary that is supposed to release the follicle ready for implantation. So it signals to the ovary. Ovary is this layer. It is this on the reproductive system. It is the one that has the eggs that are supposed to mature and do what. So when this hormone is released, it helps the egg to mature, and as it matures, this egg also produces estrogen. Like I said, it is this hormone that makes us women. So when it does, this uterus that shed, it needs to be rebuilt again. So when it is built again, the uterus is lined again, it is made ready, and as it gets ready, there is another hormone called luteinizing hormone. This hormone now is the one that is meant to make this ovary that was ready to move, and it moves on our 14th day, which is the ovulation day. So you can tell that there's a lot going on in the body, and on this 14th day, it is when this mature egg is released from the ovary. And when this happens and there's contact with a man, when there's sexual intercourse, immediately on the 14th day, you are able to give birth to a boy or a girl, depending. But usually when the ovary is released and it meets a man immediately, usually it is a boy. I'll make a detailed video on how you can give birth to a boy or a girl, and also how to know which days are safe to have sexual intercourse and which days are not safe to have sexual intercourse if you're trying to avoid pregnancy and using the natural methods of family planning. So on the 14th day, this is the most fertile time of the cycle. Like if let's say you had your period on first, it took you 5 days for the body to prepare, maybe 7 days. Then on the 14th day is the day we are releasing our mugole, the matured egg. So if it's on this day, we are there, music is there, we are waiting for the man to come. If the man doesn't come, we shed tears, we shed our lining that our estrogen prepared, we are unhappy, and the process continues. So this if fertilization occurs, it occurs there is a place in the fallopian tubes where it is supposed to occur. If it doesn't occur, the egg continues its journey, because after fertilization it's supposed to continue in the uterus and find its layer that was prepared for it. And if it doesn't happen, it goes and even the egg is released during menstruation. So if it doesn't occur, then we have our other phase, which is the luteal phase. So the luteal phase happens after ovulation. So after ovulation, the empty follicles, the ones that never matured to become an egg that was ready for fertilization, they form. There's what they form on its layer called corpus luteum, and this corpus luteum is usually there to produce progesterone that was meant to help in forming the baby, in helping the maintaining this pregnancy. But because it didn't happen, it also starts reducing. And if the egg is not fertilized, these hormone levels drop. The estrogen drops, the one that was making this lining of the uterus. The progesterone drops because there's nothing for it to do, and the lining breaks down, and this leads us to the next period. So usually the phases lead into each other. The follicular phase leads you into the luteal phase, and the luteal phase leads you back into the menstrual cycle. So it's important to understand these phases. It is important to understand what is happening in the woman's body and what is taking place, to know that when I finish my periods, immediately the body starts working again. And when it works again, it is preparing me for the next period, that there's no someone to think that I had my period this month, so let me relax, let me have, maybe if they are not ready for pregnancy, let me go ahead and do whatever I can do. So it is important to know that in the first 10 days, if let's say you have a 28 cycle, it is like usually I use this 10-8-10. The first 10 days are preparing you. The 8 days are not safe for you to have sexual intercourse, because the sperm, if a man's sperm is released into you, it can stay for at least 3 to 5 days in your body. Then a woman's egg, if it is released, can stay maybe 1 or 2 days in the body. So if you had sexual intercourse before, maybe 5 days before the ovulation, the release of the egg, these sperms could be in there playing around, and when it is released, you get pregnant. Or if you have them like after ovulation, maybe a day after, and you think maybe the egg, because for some people their egg lasts only 24 hours, but for some people it can last up to 36 or 48 hours depending on someone's body. So you could have intercourse prior or immediately after and get pregnant. So it is very important for you to understand that, so that you know how to move with them, or avoid taking unnecessary family planning methods and all. So it is important also to know, to understand a woman when they are in their menstrual cycle, because for all these cycles bring about different moods, bring about different changes. For some people, ovulation is very, very painful. For some people, menstruation, like being on the period, is very, very painful. So it's normal and it's very okay to experience these symptoms. Like for some people, they get very severe cramps and they even get hospitalized. And when someone says, I had cramps, I didn't come to work, maybe I had cramps, they think it is the people are just doing kajanja. But Cramps are there because there's a contraction of the uterus, to explain like how, like expelling a baby. You find like the uterus, it is contracting to expel its lining so that it sheds and come out. And for some people it's very, very painful. For some people they get bloating because there's fluid retention in some of these capillaries. As they shed, there's some water that seeps through and goes into maybe the stomach and what, so it causes bloating for some people, and some people it's very severe. Some mood swings, some people get mood swings because, like I said, there's that fluctuation of hormones. Estrogen has lowered, progesterone has lowered, and this can cause mood swings. You find someone on their period and they want to slap you, they don't even want to do anything. It's important to understand these things because menstruation has been, over the years, it was linked to even in the local language is ensonga, like ensonga, as if an issue, as if a problem, which shouldn't be the case because none of us has control over it. None of us decided that I want to have menstruation this day, I want to have my period on this day. So you find that some people still look at having periods as a problem, still look at having, like, being in your period as if you're finding it as an excuse or what. There's people get breast tenderness and swelling. You find that someone's breasts are swollen, are very much swollen. They don't even want water to touch. They don't even want anyone to touch them. So find partners are not being understanding. They are not. Someone gets a breakout of the skin, acne. If they have like oily skin, they get a breakout due to periods. Imagine having to experience a breakout every other month because of a period that you have no control over. It's a hormonal thing, it's a brain thing. The brain for it is meant to do that, but you cannot control it. Things like fatigue or tiredness. Someone can't even lift a finger when they're in their periods, can't even do anything, can't even touch anything. Even looking like at a phone is a problem, but you find someone is finding it as an issue. Like I said, I'm here to health educate, I'm here to give you information. Maybe you didn't know, maybe even you were experiencing these things, but you didn't know why. You didn't know why this and this was happening. So it's really important to understand the process of menstruation because there's hormones involved, and hormones can change so many things for so many people. So menstruation is a broad topic, and menstruation health is very important, especially for young girls, for women of any bearing age, even for men to understand that even for men to know that, okay, my woman has just come out of their menses, or even to know their women's menstrual cycle so that they can use it. They can help to calculate safe days. They can be able to use like condoms when their partners are in like their unsafe days, so that they feel supported, so that women feel supported. So these symptoms can be severe, they can be disruptive, they can come in different forms. And when this happens, when you don't understand, it is very important to seek or consult a healthcare professional, so that maybe there is another issue related to that. Maybe there are infections, and maybe when you had your menses, it made it worse. So it's important, when you see something deviating from normal, you do what? You talk to the healthcare provider. I'll be able to dive more into the menstrual cycle more when I'm teaching about safe days, when I'm teaching about, so that we know. So I even give illustrations on when and where, so that we know. Then also hygiene. Like, it's very important to maintain hygiene, good hygiene during menstruation, and this helps to prevent infections, discomfort. So it's important to change the sanitary pads, tampons, menstrual cups regularly. You find someone, maybe they are in a place of work, they are in their menses, or they're having their period, but even the boss cannot allow them to go away for 30 minutes to a nearest washroom and change a pad. And people omuntu n'abeera nga waakolera tasobola kuvaawo, n'abeera ne pad. They stay with a pad for the whole day. This is very dangerous because this is blood. It is fluid. It can retain infections. It is yegatane sweat. What happens is not good. So it's important to change these things, change pad, tampons, every 4 to 6 hours to maintain a good hygiene, a good order, and everything. So to wash regularly, you wash mild soap. We know, ladies, that we're supposed to, wash down there, just plain water. But during the when you're having a period, at least use a soap. Washing soap, don't use scented soaps, to just stay clean, and then dispose menstrual products properly. People are throwing things everywhere. It is crazy, but it is important to maintain menstrual hygiene, especially in the communities that we live in now. We are living in crowded places now. We are living in like apartments, what. So if you don't dispose, you're interfering in other people's hygiene. So and then it's funny, there are very many myths about menstruation. Like I said, Edda, it was a very, those early years, there were very many myths. They used to look at menstruation as because people were not educated, they couldn't even access painkillers. Someone gets into their menses and they maybe they are in pain, and then they feel like many girls were beaten up because of menstruation. There's this myth, you can't exercise, you're supposed to be in a corner, because they used to look at it as a problem. Hide, don't go anywhere. But exercise, like walking, it helps reduce cramps, it helps in helping improving the mood, even the blood circulation. So it is very unnerving to learn that there are people who were beaten up, who were closed inside doors because of menstruation. So there's still more to educate about menstruation health. There's still more to educate about why people menstruate, because it is a part of life. It is like why people go to the washrooms. You cannot control it. You cannot avoid it. People think that menstrual blood is dirty or impure, that maybe if a woman touched you, because there is even still some religions or who, when you're maybe in your periods, you're not supposed to go for prayers, or you're not supposed to take part in certain whatevers, which I can't go into detail, but it is not impure. It is a mere but menstrual blood is a natural and normal bodily fluid and function. It is not a sign of impurity whatsoever. That girls should not bathe like maybe during their period, and you wonder, now if you don't bathe, then you get infections. So there are so many myths that were related with menstruation, and I would wish to dispel them. I would wish for us to learn and learn. I'd wish for you to tell a young girl out there that menstruation is normal. It is a normal process, and there are times when it's important to have it, because it shows that your body is working normally. And it's also important to seek medical attention when you have had heavy bleeding, bleeding with clots, bleeding that lasts for more than 7 days. You've had severe pain or cramps, you can't do anything. You cannot even, you're in severe pain. If you experience something like that, it's important to seek medical attention, because then we are in an irregular menstrual cycle. And also menses, like I said earlier, that are irregular or absent. If you're not pregnant, you may be spending 3 months without going in your periods. You're not on any family planning to interfere in your menses, but then you are not seeing your period. When something like that happens, it is important to seek medical attention. Or any unusual discharge, you are having after your menses, there's something discharge that is coming afterwards. It is important for something abnormal you see, especially for us women, to seek medical attention and to do it. So it is important to normalize conversations about menstruation. If you see someone talk about menstruation in any way, it's important to empower them with knowledge. And people who menstruate should be able to manage their periods with dignity and comfort without stigma or shame. There's been a lot of menstruation stigma, and I'm all about dispelling stigma, because good menstrual hygiene and access to products are key to ensuring that everyone can live healthy and have healthy periods. So it is important also to have period products like menstrual products, pads, tampons, what accessible. If you can buy something for a girl, if you can have these products accessible in centers, in health facilities, it would be very, very, very important. So menstruation is a natural part of life. Let's take that home today. It is a very natural product, and when you understand the menstrual cycle and you practice good hygiene practices, you dispel all these myths, and we support healthier lives for ourselves and others. So let's continue to respect and support each other, ensuring that menstruation is understood and managed in a positive and informed way. If you have any questions, if you have not understood anything, like I said, I'm going to discuss the menstrual cycle in details, and I'm going to make you understand how all this happens. But I'm grateful to have you here. I'm grateful for you to watch my videos. Please like, share, and subscribe. I'm grateful for you being here. Thank you so much.